The next topic is the headlined with the SIP Thematic Network program, What's Next? And I'm sure he'd love to be here, but unfortunately it was not possible, so he gave a video message. Let's watch Martin Sekel from the European Commission, DG Health and Food Sanity.
The 2019 Symposium on Social Impact of Pain. I regret not being with you in person to discuss the important chosen themes, but I'm looking forward to learning about the outcomes of your event. I believe that the relevance of social impact of pain cuts across many fields. We need to raise the awareness of the whole range of relevant actors about pain and to inform them about the best ways to address it and increase the quality of life of patients. In June 2017, a thematic network on social impact of pain was created under the EU Health Policy Platform. This platform provides an opportunity for interest groups to get in contact with each other. In 2018, SIP ran in parallel a thematic network and a stakeholder network in the platform. And the SIP produced a joint statement which was presented in 2 webinars available on the Public Health website dedicated page. They presented their final joint statement at the EU Health Policy Platform annual meeting. Since then, SIP continued their work in the stakeholder network and the platform, which so far has 117 members. Let me now say a few words about the future. The new Commission took office only a few days ago. The mission letter to the Commissioner for Health provides clear priorities for the coming years. For example, the need to support member states in constantly improving the quality and sustainability of their health systems, ensuring the supply of medicinal products, making the most of the potential of e-health to provide high-quality healthcare and reduce inequalities, putting forward a plan, a Europe Beating Cancer plan, to support member states to improve cancer prevention and care. As you all know, pain care and recognition of pain as a disease or a condition falls under the responsibility of the member states. But the European agenda is clearly linked to preventing and addressing pain. And I can take the example of the Cancer Action Plan. It should propose actions to strengthen our approach at every key stage of the disease: prevention, diagnosis, treatment, life as a cancer survivor, and palliative care. And to be successful, we must tackle cancer holistically, from multiple angles and involving multiple stakeholders, including those outside the health sector. This approach will also support member states in reaching the UN Sustainable Development Goals and the WHO targets on non-communicable diseases. And I want to stress that public health authorities cannot address this challenge alone. A health in all policies and multi-stakeholder approach is needed to effectively establish healthy lifestyles and reduce the prevalence of cancer. Finally, I would like to update you on the opportunities for health under the new multi-annual financial framework currently being discussed in the interinstitutional setting. The Commission proposed an envelope of 101 billion euros for the European Social Fund Plus, and a dedicated health strand is incorporated in the ESF Plus with a budget of 413 million euros to support national reform processes for more effective, accessible and resilient health systems and better health promotion and disease prevention. In addition, the health cluster of Horizon Europe will have a proposed budget of 7.7 billion euros. These funding programs will strengthen the potential of EU-level cooperation to deliver significant added value on prevention and control of non-communicable diseases. By continued collaboration, coordinating effectively, using all available tools and focusing on prevention as well as treatment, we can better protect the health of Europe's citizens. I wish you a very productive conference.
And you can introduce the next speaker.
I am delighted to...
Okay.
So I think that this was actually a perfect segue in our next speaker, and also this is very important for our last session where we will talk about the future, what can be done. But first, let's take a step back into the past and this important achievement that we have with the Thematic Network program. So I'm delighted to introduce you Brona Fullen. She's the Associate Professor and President-elect of the European Pain Federation. As Bart already says, she's the first female president, but I mean, I am proud to work with her on a personal level.
Thank you, Victoria. So, as many of you know, the vision and mission of the European Pain Federation is built around three core pillars: research, education, and advocacy for improved government policies impacting on pain. And we do this, I suppose, by, as we're doing today, shining a spotlight on the societal impact that pain incurs. And in the European Pain Federation, our advocacy work is chaired by Professor Thomas Tulla, who works with Victoria in the Executive Office. These are my disclosures. However, I would also like to disclose that I don't think in the next few minutes that I've been given that I can adequately capture the significant effort undertaken over the last number of years by everybody in this room and beyond, but I'll do my best. So I'd like to briefly outline, I suppose, our work over with SIP in the last 10 years, summarise the outputs and our outcomes that have allowed us to build and strengthen, I suppose, the work of SIP. And these discussions then will frame the rest of the day, whereas Victoria mentioned we're building on where we're going to next. When SIP was awarded one of the thematic networks, Victoria Carrera, representing the European Pain Federation, and Anka Pop from Pain Alliance Europe, led this work on behalf of the large number of partners in SIP. And the thematic, obviously developing a thematic network, allowed us to collate, I suppose, documents summarising the impact that pain has, relating to best practice policies and to best practice and policy initiatives. And developing these statements and putting all this information together is so important because these statements directly influence the European Commission's approach to health policy. So what did we do? With input from we engaged with our stakeholder community throughout the whole process, initially virtually with thanks to the European Commission that hosted 2 webinars where we refined and discussed our documents. We then moved to face-to-face meetings with our more closer allies. Many of you are here in the room today, and this provided input for our documents that we produced. So in terms of our outcomes and outputs, we produced 3 papers. The first paper, the SIP framing paper, and I suppose this identified existing policies and advocacy initiatives relevant to tackle the societal impact of pain, and this acted as a foundation, I suppose, for the development of the SIP joint statement that we also produced. And the SIP joint statement, I suppose, summarised agreed recommendations to address the gaps identified in the SIP framing paper. And I suppose, in essence, it compiled a list of policy asks for governments, for other stakeholders, and I suppose as us, as organisations, in trying to move forward with improving pain policies. We also produced an infographic, which you can see. Again, it's just a visual representation of our work that's easily distributed, and I think a useful addition to have in terms of communicating our successes, but also our asks going forward. So these papers then allowed for further engagement with stakeholder groups, and as you heard from Bart earlier, our documents have been endorsed by hundreds of policymakers, patients, healthcare professionals, civil societies, and the private sector. And since our year as a thematic network has finished, we have further honed our document and summarised it into 4 key, I suppose, asks that we'll be discussing and that will inform today's discussion. So our priorities are pain as a health indicator, pain and employment, pain research, and pain education. The document also facilitated the development of the SIP toolkit, and this is a great framework for individual countries to develop their own national SIP community. I'm delighted to see that we have 9 national SIP chapters, and I'm sure there are more to come. And this is important. National SIP chapters are important because it allows each country to gather relevant information necessary for communicating with their individual governments with regards to policy asks for improving pain. So moving forward, I suppose the remainder of the day is I suppose focusing on the successes of the last 10 years, but then deciding where are we going in the next 10 years. We need to build on our successes so that we can advance pain, reduce the impact of pain from a societal perspective and build a strong foundation for the next decade of SIP. Thank you.
Thank you very much, Bruna. Thank you for your presentation. Are there questions to what you have heard? Or maybe you wrote a question, what's next and how can we capitalize on it? There was one question, how can we capitalize on it? There was once, can we just have this one SwarmWorks question, please? Yeah. What comes after the SIP Thematic Network program? How we further capitalize on it? Maybe you can briefly, you probably answered it already a little bit, but...
Well, I think that's the purpose of the rest of today's session. We have our 4 priorities, so we need to come together and devise, an agenda going forward that can build on. We've identified where the limitations are with our documents, so, in a constructive and concise way, we work through the 4 key priority areas and strategize about how we can...
Prioritization and strategy.
Yeah. Across...
strategy across the...
Pain as a healthcare indicator, education,
the 4 pillars.
Research. Yeah.
Thank you. Any other questions from the audience? Don't be shy. That's not the case so far. Is there anything you would like to add? What we just heard?
I think that Bruno summarized it perfectly.
Put it a little closer.
Yes. So, indeed, today we will try to give answer. We will try to focus on concrete point for implementation of the 4 pillars that the joint statement has identified. And we open the discussion.
Thank you very much. Victoria, Bruna, thank you.